Hey guys, welcome to episode 74 of The Green Life. In today's episode, we're going to discuss oral hygiene and holistic dentistry. For this episode, I actually invited my own dentist, Dr. Anabela Peres de Sousa. She is based in Porto, Portugal, and she's a fantastic dentist. She looks at health holistically and she understands the correlation between mouth health, oral health, and the rest of the body. And I think this is such an important subject to tackle because a lot of people don't really think about their teeth, their gums, and oral hygiene as something that is part of well-being and complete wellness. Now, before we get into the episode, a big shout out to Nama Well for the JT juicer, the best juicer ever. If you are on the market for a new machine, you can use my code below. And no, I don't make any money from this, it's just a gift for you. I do, however, have an affiliate account with Dr. Robert Morse. As you know, I'm studying to become a naturopathic doctor and I absolutely love his herbs and the way that he looks at health. And we talk actually about it in the podcast today, about the lymphatic system and what I learned from wonderful Dr. Morse. So if you are on the market for a cleanse and you really just want to support your organs with some herbs, I really recommend his. I'm happy to help you choose the right ones. You can buy everything from the link below. I even have a discount code for you that is evergreen. And that helps the podcast because I do make a little bit of money from it. So you are supporting the green life. All right, back to the episode. We're going to dive into this great subject and really tackle a few questions that came up from people that didn't know about fillings, mercury, root canals, and the microbiome of your mouth. There is so much to talk about, so much to discover. So without further ado, let's get into this. Welcome, Anabela. Hi, Anabela. Thank you so much for joining me on The Green Life today. How are you?
I'm fine. Thank you, Chantal. To be here with you is a really great pleasure. I really love you, and I really love to talk about this.
Yes, and I love you too. And I think it would be really good to tell my listeners that you actually are my dentist. You're a holistic dentist in Porto, and you take care of me. So I trust you 100%. And I also know that you know so much about holistic dentistry, but not just dentistry. You actually understand health overall, which is why those beautiful things come together. So can we just give everybody a little introduction about you and how you became not just a dentist, but a holistic one, and how you actually got into health? I'd love to know your story.
Okay, thank you. Thank you very much. And it's really good to have you as a patient. And all patients like you, in your energy, in your vibration, makes me very happy and full of energy to continue.
Yeah. Oh, thank you.
Yeah, because I was 20 years a conventional classic dentist. I start to see something else in medicine when I have my two daughters, and when they are very young and start to have asthma and that little infections, thanks God, but I didn't want to give them antibiotics and all the medicines that pediatric approach gave me to them. And I start then to learn about homeopathy. Homeopathy was the first knowledge that I archived outside of the conventional medicine. And then I wrote iridology to understand the iris, and then was the first approach to the systemic inside an organ. And then I learned that the mouth is a system too. We may see all the body in our mouth, like in our ear or in the hand. We can see all the organs. It was a surprise for me having this approach in the mouth. You may see all the organs. How could it? I never heard something like that in conventional courses, and and was like that, and I start my formation in dentistry because I was assisting a familiar working in dentistry. He was a really good doctor in his time. It was different. He gives time to listen his patients, and I learned that, and I was to dentistry because of that, because I could be sit side to side to my patients and have that approach and listen him and work him with all the knowledge that I could have. In the beginning, my knowledge was dentistry, the classic one. But when we are with attention with our patients, we heard lots of things that interact with the health and the point that our patient is in that moment. And it was really, really great for me when I start learning about homeopathy and this kind of medicines, traditional Chinese medicine, Ayurvedic approach, and all of them talk about it. Listen to the patient, feel the patient, and oh, this is really beautiful. And personally, I was archiving a new lifestyle. When I started to learn this, I became a different person. I was more wake up to my essence, to my soul. And then it's easier now for me understand the person that is in my share. And it was like this that I became a functional and holistic dentist. Then I always was learning and I will be learning all my life if I had health for that. I made some courses in Switzerland. That was very, very important for me because they gave me a way to put in practice in dentistry this other kind of approaches. Okay, because when I started to learn, it was very beautiful, but when I was side to side to my patients and what I'm going to do with all I have in my head, because my patient doesn't know where he wants to have a feel in the tooth, and he was not expecting more from me.
Yeah.
But there was a time that it was a real little difficult for me to put it in action.
Yeah.
And Switzerland, Germany, Spain, and Brazil. And this last formation, this last course, and the bigger one in Brazil, was really impacting. Was really important to structure my dentistry, my biological integrative dentistry.
Yeah, wow. I love that. And I can so relate because so many aspects actually. The one thing is I grew up taking antibiotics every year because I used to be getting also like always a throat infection. My parents used to just obviously listen to the doctor and give me antibiotics. That caused such big issues for me, for my digestive system, that I basically was constipated for 20 years. And so it destroyed my gut, and I had to rebuild it from scratch. And it was, just the ignorance of them because they didn't know better. But like just this pushing and pushing instead of looking at the root cause. Why is this child getting sick? And actually, I think that if they let me just ride out one season without any antibiotics, I probably wouldn't have gotten it anymore. Like I would have been fine. So, that kind of approach, I totally understand why you would start questioning, especially when it's like, it's my babies. I don't want to pump them with medicine. And the other thing I really resonate with is, how it is sometimes difficult when we learn something. So I studied nutrition the first time, like classically, and I don't even use that diploma anymore because I just know I learned the wrong things. And I just finished the holistic nutrition now, which was such a beautiful encompassing of health as a whole. And again, we look at, the whole physicality, but also the spirituality of the person. And I'm like, why do we always dissect the body and not connect the dots? And as you said, all these beautiful ancient teachings, they connect everything, like the body's working as a unit. So for me, as a child, obviously seeing the dentist was like, oh, my teeth. But as I became more aware of the body, the teeth really became this like amazing pathway into, and it is actually the entryway really for our digestive system. So entryway in the body. And when I started looking at rebuilding my digestive system, the mouth was the first thing. What am I cleaning my teeth with? What am I actually eating? And slowly learning more and more about it. So given this intro that you gave and given the approach that I'm also taking, can we explain to people that maybe are really still struggling with the concept of holistic dentistry? What is it and how is it different from a classical one in the way that we look at it?
So in a few tips, we can say that an holistic dentist is a person that have the classical degree of dentistry, but the dentist himself have to make a process of learning of himself. Okay, and then it becomes a lifestyle of the dentist to become to his practice. And because when we work in holistic therapy, and in this case dentistry, we are giving love in our treatments, because we know that is the key of our soul to grow up in this life. And in that way, what we have in our practice that we may put love, so is the respect for the patient. If I know that there are materials that have toxics in these components, but is cheaper than others, why I will put that in my patient? I love my patient. My patient comes to me. I'm grateful because the life put me with this gift, and I have to do the best I know. So select the materials is not easy, because the industry is very difficult to know what is inside of the materials and why they don't put more clean materials in to work. But there are in this moment they are more expensive. I don't know why, but yeah, but we have that already. Composites, ceramics, materials without fluor and without mercury, without metals in restorations and in prosthetic rehabilitations, the orthodontics without metals too, and understand what is respecting the natural of this patient. What is best for you maybe is not the best for your another patient.
Yeah.
Don't have protocols. is essential in holistic dentistry, in holistic medicine.
Yeah. Yeah. Guidelines, not protocols.
Is that. And personalize everything that we are doing is a challenge. Is more difficult, and is more difficult to teach this approach to our team. But it's a challenge like others. This is mine and from other colleagues that are working like this, and I hope that is more in the next years.
It will grow.
Is the way. And when we have the patients with these toxic materials, knowing how to deal with this, this is important too. It's not just have good materials to work, but most patients have already fillings and treatments and so on. And our work is differentiated in the moment when we may touch in that safely. And I'm thinking this moment in the mercury fillings.
Yes,
it's very important to know how to put it out.
Yes,
in that moment is very toxic.
Yes. So can we talk about that a little bit more, actually? Because I think a lot of people don't understand that the old fillings or the classic fillings with silver/mercury have mercury, and mercury actually does sit and bioaccumulate into our brain. And although we have this connection, and thyroid, of course, although we have this connection, people are still not making the connection because the dentists don't talk about it. So we're talking about classic dentists not talking about it, and probably don't even know. I'm not sure, because I think one of the things you mentioned, you hinted at, but we didn't go into, and I like to talk about regulators later, but one of the things that I feel that there is obviously, like in standard allopathic medicine, there is very much a mafia that controls the curriculums, that controls the information. So anything that people want to talk about becomes highly questioned, even though there's evidence and there is, there's supporting evidence and there is a common sense about it. And I feel it gets lost in the paperwork and in the convenience, but also probably in financial benefits for certain companies, certain people. And do we really want to make people healthy? That always becomes a question. And of course, you start looking like a thin head because you're like, this doesn't make sense. But I feel those things are important to talk about. So when we talk about classic dentistry, do they actually understand the risks that come with putting a normal filling? That's the first question.
I don't think so, because even for them, there are danger.
Yes.
If they I don't understand why at this moment we are not all working safely with mercury fillings. In the moment, recuse putting more and have safely procedures to take it off.
Yeah.
Because the professionals are intoxicating too in both moments.
Okay. So when the filling goes into your mouth, obviously you said as you put it in, that's toxic. As you take it out, it's toxic. It's more toxic. But what happens when it goes into your teeth? So for the client, for your patient that has the filling done with mercury, what happens at that point when that sits into their tooth?
The mercury fillings may evaporate a little. This mercury is always evaporating.
So it's leaching. Okay.
Yeah, leaching. Yeah, and this is a few percentage. Is lower percentage in this moment. That's why I say to everyone that if you don't have a holistic dentist putting it out safely, don't touch it. Don't touch it. Okay, this is important because when it stays at mouth, the percentage is leaving from the tooth to the system is very low, but it happens. It is real. If you have more than one, you have more problems, more percentage, and you have another thing. You have galvanic energy inside your mouth.
Yes.
Is another kind of radiation. Okay, so you have two problems with this. And if you have more than two, so is really incredible if you are going to test the galvanic energy inside the mouth and you see going up is incredible.
Yeah.
And it changed the polarity of the membrane of the cells.
Yes.
So you are having this risk.
Wow.
When we see our patients, even then that healthy patients, this is a tip that we have to say to our patients: please put it out safely and not urgently, but we are going step by step doing that because it's important. This is a disrupt field.
Mm-hmm.
There it is changing the energy even in all the meridian that tooth is located. Okay.
When you say that the galvanic energy is actually changing the structure of the cell, so it's changing the vibration of the cell, what can happen? And is this related to more cases of periodontic issues that people have? Because I don't know if it's an age thing, and obviously my peers are in their 40s and 50s now, so I'm like, but more and more people are getting like gum issues. I'm like, why? So I don't know if that's maybe related to what the fillings are doing into their mouth, the energetics. I'm not sure.
No, I don't think so.
Okay.
I am periodontologist in the classic degrees. That is my specialize. And in periodontitis, that is the inflammation and infection of the tissues around the tooth, bone and gums and mucosa, we have to deal with microbiome. Is another tip for me is my lovely tip. Because this is very, very important. We have patients that girls that don't have pregnant. They can't. And when we clean these gum pockets, the process goes on.
So they get pregnant.
Yeah, this is really incredible because periodontitis has a straight relationship with the pregnancy.
I can see that.
Yeah, it's really important. This bacteria that is growing on inside the pockets of the gums, they have communication with the blood, and it's very easy to have this door to go then, and by the digestive system. And now we know that these bacteria energetically talks with all our microbiome. I have patients with chronic cystitis, and when we treat the oral microbiome, it stops.
Wow.
It's really incredible because we have mainly girls and women suffering from this years. And the classic dentistry, sometimes if there are not a periodontitis, yes, because you may have um, inflammation in the gums without the diagnosis of periodontitis. But the bacterial plaque is already maturated to give home to some bacteria that now we know they are responsible for that cystitis. And nowadays we know there are some articles published already that these bacteria are related with pancreas cancer, with Alzheimer, with Parkinson, with heart diseases, and these pregnancy problems too, diabetes. There are scientific proof of this.
Yeah.
But sometimes it doesn't come to in our patients blooding and swelling. You don't have to see this. Sometimes you have just little points of inflammation. But if you are listening patient, if he is talking to you that he has that chronic problems in the guts, in the cystids, okay, maybe this little point in the mouth could be not important for the patient, but because he doesn't know that it is the impact of other infections that are in the system. That is really amazing when we go there, and sometimes it's not difficult. And keep this patient informed how to keep these pockets clean and without this dental plaque maturated. Because the time we always have bacteria in our mouth, and this is normal. This normal and this good is our microbiome, is our resistant barrier of infections, is the first barrier of our immune system. But if we don't have the clean enough properties, we are getting a maturated plaque that gives home for these pathogenic bacteria.
Yeah.
And sometimes when the people hear from this, okay, I will put Listerine in my mouth every day, and they want to get fire in the mouth to kill all bacteria. And that is another problem. And I see lots of patients, and there are a lot of people that are doing this daily.
Yes.
It is really incredible. And I said, no, you don't have to do that. Sometimes you don't have to use any chemical substrates. You just have to think physically, mechanically. Your hand your hand have to be a good hand. Right movements, rotational movements, and not
which is actually what my parents taught me, and that is why I actually have two spots where I have receding gum, because I didn't brush right. I brushed too harshly and in one direction.
That is not good. And the rotational with love, okay? Tooth by tooth, tooth by tooth, tooth by tooth. And when we do all the arcades outside and inside, and the upper and lower faces, we have to think the space between these tooth. This space between the tooth is the key, because is always in this space that becomes the maturation of plaque. This bad bacteria is this first place, and when they get time to construct a rock making
A shield.
a shield, yeah. Okay, they get an aerobic home, and then we have all the bacteria that are impacting our general health. That is real important to avoid this. And how to clean these spaces. We have dental floss, we have water floss. I love water floss. And we have the massage with our fingers too. We may use ozone oil, we may use coconut oil, we may use even clay. I really love clay mixed with coconut oil, and sometimes I say to patients to put in this amalgam probiotic.
Mm.
And you may construct, you may build your own toothpaste. Yeah. So you don't have to use alcohol and hard things.
Yeah, and I think, I think a lot of people, I think actually it's important if we talk about microbiome for a second, just in case people haven't heard it before. So if you haven't heard it before, I don't know if you've been under a rock, because microbiome is like the buzzword of the past 6-7 years. But I think, and a lot of people might just connect microbiome to the gut, but actually, as you said, we have microbiome in many places in our body, our skin, our mouth, and it makes so much sense that we don't want to use anything harsh, because I think people don't think. I'm going to draw a parallel here, but we have in the gut we have the microbiome, and then we have the immune system behind the gut lining, and that's majority of our immune system, about 70-80%. But even in the mouth, if you think about it, we have the mouth, and then our tonsils are actually our immune system entry point. And this is why it drives me crazy when doctors just take freaking tonsils out when they get inflamed, instead of saying, why is this happening? Like lymphatic system, for example. Let's look at that. So the symbiotic relationship between your mouth microbiome and your immune system through your tonsils, I think that's really probably a very important thing. But when people have to understand, because I think we're becoming a little bit germophobes. So people are like, bacteria, bad for you. But actually, again, some bacteria, yes, can be harmful, but others are actually very beneficial. They live in a very symbiotic relationship with us. So when it comes to the mouth, aside from the tips that you created, or that you shared, what are the most important things to look at to guarantee that you have an environment where you have a happy microbiome, and maybe some tell signs as to, okay, your mouth actually is in good conditions, your microbiome is in a good state?
Yeah. So your nutrition is very important. What you eat, what you put in your mouth is very important to keep a good pH for good bacteria. The health of the tonsils, the saliva, is very important. That becomes from inside, from your general health. If you have a good saliva, you have a good home for good bacteria. But when we talk about microbiome, in this moment, medicine talks about microbiome like a new organ in our body. And for me, in this moment, the microbiome is the most important organ that we have in our body.
Mm-hmm.
Because if you have a good microbiome, and we are talking about gut and skin and mouth, it is the same microbiome.
Yes.
We don't have to separate, because bacteria talk each other.
Yeah.
We don't know yet how they connect, but it's really amazing what quantum medicine are saying to us about these connections. I don't know if you know, but there are articles published too that the cancer of gut, the colon, the tumor has a capsule And the capsule is formed with Fusobacterium nucleatum. It's a bacteria that grows inside the gum. It's really amazing.
Yeah.
Because some years ago in classic medicine, if this information couldn't be accepted, because for us classical doctors, our stomach is so acid that these bacteria is dead when they pass through them. And then in the intestine, we don't have bacteria from mouse.
Yeah.
But yes, we have. So everything is challenging us to keep our mind open, because we really know a little bit about this, and the microbiome is really important for our health. I would say that if we just treat our microbiome, we are in good health for all our life.
Yeah, we can definitely recuperate.
Our bacteria are 90% of our body cells. We have more bacteria than human cells in our body.
Yes.
The genetic from them are more impacting than our genetic.
Yes.
It's really amazing. So we have to respect these bacteria. So we don't have to put alcohol inside our mouth, because we are killing our good bacteria, and they live with us. Bacteria, fungus, virus, and parasites. We have all of them working for our health. But the challenge of keep them in balance, I guess, is what we have to do. We, doctors in dentistry, in general health, in nutrition, we all have to see how to keep healthy my microbiome. Yeah.
100%. I'm studying naturopathy with Dr. Robert Morse, who I think is such an amazing human being. Like you will love him if you don't know him already, because you say like you're really vibrating at the same frequency. But one of the things that I learned from him that I think is really amazing is lack of understanding of the lymphatic system by the allopathic medicine, and how even in my anatomy and physiology books, I just look at it and I can't see how they don't really know much about the lymphatic system, so they really talk about it like in a way that doesn't make sense. But I think you mentioned obviously that the microbiome is such an important part. We have trillions and trillions of bacteria versus even billions of cells, so much bigger. But one thing that I think really it marries the lymphatic system is this. Our body works in such a perfect way that when we are creating, we are metabolizing all the time. So there's always waste, and waste goes out of the body in a safe way, which is actually also why heavy metals will lodge in fat and not just in the blood. Otherwise we would die. But in the lymphatic system point is about, I think the microbiome and lymphatic system also work together, because of course the lymphatic system is part of the immune system. So we need to understand how to detox the body of all these things through our kidneys and through our gut. And it's fascinating to me how we don't talk about these main systems together. So for me, microbiome and lymphatic are like the biggest, because of what I learned from Dr. Morten. What you just said now, it just hits at home. It's like, yeah, those are two massive systems that really work together. And if one of them doesn't work well, so if the microbiome is off balance, then you have pathogens taking over. If you have the lymphatic not working well, then you have toxins overriding. And when that happens, it creates an acidic environment, which of course our microbiome that are happy and healthy and good don't like. They want a nice pH. By the way, you have to share with me what is the right pH for your mouth, because people can actually test with little testing strips as well to understand if they're eating the right things, if they're taking care of themselves well. But it's such a powerful concept, right? To just embrace these two big systems and actually understand how they work together.
Yeah, the right pH is like our urine. Yeah, you have to have the neutral pH. since 6 to 7:30. This is the middle range that is okay.
Yeah.
If you are in acid or you are in basic one, you are giving home to growth the species that you don't want.
Yeah.
Okay?
Yeah, exactly.
And the hydration is very important too. The quantity of saliva you have in your mouth. Then it brings another tip that is you are using or know your nose to have your inspiration and okay, because if you are in an open mouth when you are sleeping, you are drying your gums and your saliva is not enough to keep the enzymes and the protection of the tissues in your mouth, and you may have decays and gums inflammation just because of that.
Yeah, makes sense to me.
Yeah,
so people that snore have a problem, obviously, with that.
Yeah, with sinusitis and rhinitis and all these kind of problems in respiration, they have problems in mouth too.
Yeah.
And the position of the arcade, if you don't get a good position in occlusion, you may have problems too, because of the lack of space to clean, and lack of space to have a good respiration canal, and the postural connect occlusion to muscles is very important too. Is another tip that you have to have in mind.
Yeah.
When and that is important. Talk about when you lost a tooth, the importance to put another one in the place, not just for aesthetic, but to keep the movement of the other teeth quiet, and keeping the natural work and occlusion more natural possible.
Yeah, I agree with that. And I like to segue in something really important, because we talked about microbiome and the importance of the bacteria. And we talked about what happens when we create environments where we have anaerobic environments where the bad bacteria can really propagate. And I like to talk about root canals, because root canals are like the championship of horrible things to do. So let's talk about them, because every single dentist will tell you to do one if you need it, and they leave it at that.
No, for classic dentistry, the root canals was an amazing treatment, because when you say, okay, I don't want my tooth because this give me a awful pain, I can't do it, and the root canal is really magic. You don't have pain anymore, and you stay with the tooth. So it was a fantastic, until we know these things about microbiome.
Yeah.
And we know the anatomy of the tooth, and the tooth has the main canal, but he has lots of secondary canals, little canals, that the treatment of root canal doesn't have access to them. And when we have infection inside the tooth, all these canals are infected. All this area have toxic elements from the metabolism of these bacteria, these pathogenic bacteria. And the root canal results from putting out the main nerve and the organic material inside this main canal, and all the others keep depth with the toxic material, but the tooth becomes in silence. and the patient thinks, okay, I'm okay.
Yeah.
And what we see now with this archiving, this new approach of medicine and the knowledge, we have chronic bacteria that love to be in these houses of oxygen, and they keep growing. And sometimes when we see a root canal that was done 1 year ago, and I see the X-ray of this patient, and we have a cyst around the tooth, and this cyst is the body trying to isolate this toxic material from the system. And sometimes the classic dentistry says, oh, no, that's okay. You don't have pus, you don't have blood. We just keep seeing that. And in the holistic way, we see this, and we are going to see all the organs in the meridian of this tooth. And sometimes we see that the patient is with stomach problems and the liver problems and the lung problems. And this is the organ that is in that meridian. And sometimes it doesn't have to be in the meridian. Because of what you were saying, the lymphatic system drains these toxic materials, and it doesn't never is clean, because it's always there, and all the lympha becomes with toxic materials.
Yeah.
And the source is a tooth.
Yes.
That's why when we put out a root canal with this characterization of toxic in the bone around, is incredible. And in my practice, I have a few moments of really wow. We put that tooth out, and patients related some heart disease that disappears, Hashimoto disease that disappears, and it's really incredible.
Yeah, amazing.
Yeah, it's really amazing, and that's why root canals. Oh God, I know when we have the moment of the first infection and people comes to the first pain, and the structure of the tooth is a shame, because the tooth is good. It has a decay deep, but the structure is intact. And I don't feel comfortable to say I have to keep out your tooth. And nowadays in biological dentistry, what we are doing, what we are trying to do, but always carefully, is working with ozone gas in this moment, trying to get these parallel canals and the little ones with the gas. Yeah. Mechanically, we don't have a way to touch them, but with the gas, I guess, and there are some articles already writing about this, I guess is a more safer process.
Yeah.
I really feel very happy when I have patients without root canals.
Yeah, absolutely better. What about, there are some dentists out there that would say, still talking about root canals removal. So when you remove the root canal, obviously you're going to replace it with a tooth or a structure that will mimic the bone and the tooth. But there are a lot of adverts out there that talk about this process being quick and easy. But I know that you actually take your time when you do that. You make sure that everything is done properly, it's healed properly, and using ozone in the
Yeah.
spot to make sure that there's no infection. Can you take me a little bit through that so that people understand when they're talking to the dentist, perhaps maybe if they're not biological dentists, how they should approach this and what they should look for if they're looking for a biological dentist?
The marketing is selling the quick treatment and you don't want to be without a tooth, but you don't have to be without a tooth. We may put an adhesive tooth in this middle time, but it's very important to respect the bone that was touching that tooth. That bone is with toxins too. Is just not the tooth. So, and if you are putting out this tooth and immediately are putting an implant in this position, you may keep the toxins there, and that is a problem, a very big problem. And we have in our clinic some patients that come to us after a failure in an implant with infection. And why? Why an infection in an implant? An implant is a sterilized piece, so you don't have to have infection around. You don't have the bacteria of the root canal, but you may have them in the bone. So if you put the tooth out and put the implant in the same moment without respect this time of cleaning out, it cleans itself.
Yeah.
I respect that, and I use ozone in the moment, and sometimes I risk to put in the same moment, but when I don't have any image of suffering tissue around the tooth. If I have a tooth with root canal with some hairs in mouth, I don't do that risk.
Yeah. We'll wait. Yeah. That's common sense to me, and it's a much more careful approach. I think we're so used to having that silver bullet, like, okay, well, I want, this sorted today. And the people don't think about the consequences. But that actually segues for me in another way. Like I think the approach that you take allows the body to also welcome a new organism into the mouth in a much more peaceful way, because I think we still have to respect the fact that you've taken something that belongs to the body and then replaced it with something that is foreign. Why do you see so many people are rejecting the implants sometimes, when even though you've done everything well? Where do you think that could come from? And feel free to go a little bit esoteric about it. That's okay.
Yeah, but even in plastic dentistry, we have these two answers for the rejection. One of them is the infection. And the second one is the strange body inside your body, no? And your immune system are saying, okay, this is not ours, and we don't want this here. And when it occurs, in the first mouth, the process is done, and our body put it out. Okay. This is a rejection, a clean rejection of the implant, okay? And we don't have infection. We are just listening our body to say, this is not mine. Okay. And sometimes in this moment, we are talking with the allergy of some components of the implant. And some people may have allergy to the titanium and some to ceramic, I guess, is not so usual, but it may occur too. Yeah. And the ceramic has one thing, that the ceramic doesn't have surface treatment, but the titanium implants have. they have a surface treatment with chemical treatments, and sometimes people react of that with that materials, and this could be a reason to. And we may talk of other reasons that they are not so scientifically proved, but if we are talking with about trauma, is really interesting, because in our body we have more fragility in some places of our body, and teeth are really that places of fragility, and our teeth becomes in a specifically times of our time of life. And sometimes we keep some trauma in that place, and that tooth becomes the only tooth with a decay, with a gum inflammation. It happens. It's amazing. It happens. I have lots of patients that I'm seeing them years, and we have always the same tooth talking with us.
Yeah.
Everything is okay, but that tooth. And in these patients, I can say, you don't clean that tooth well. And
Yeah.
no,
you can't say that. Yeah, it's not.
Say that. So it puts us in another vibe. And sometimes we have to talk in the years that tooth was building on, and what happened emotionally, physically, and is amazing. Is really amazing that sometimes we clean with that process some trauma originated in that position. I made that work a few months ago with a girl that put an implant, a ceramic implant, and she is a therapist too. She made everything okay in Brazil, and she comes to Portugal, and she found me because I'm holistic to continue the good job that she was doing. And when she comes to the, I don't know what is happening, because my implant is totally moving. An implant, and everything okay. The bone was clean without infection, and she has the implant and the crown, all in ceramic, everything well done.
Yeah.
And I say, okay, and what's happened with the tooth that you have in this place? Oh, don't talk to me about that. This was the tooth of my life, because I have problems with this tooth since I was a child, and then it was having fillings all the time, and then a root canal, and then a surgery in the bone because all the life she was having problems, and you treat the emotional trauma you may have in this. What? I didn't hear, and we start talking with this Tima, and she cried, and she talks about some things, and okay, this is what the truth is talking to you. You have to clean this, before you put something in this to work.
Amazing. It is amazing. When we did my work for that tooth, I told you I had to grieve taking out that tooth. I had to do the grieving, because I knew that if I hadn't done that grieving, I wouldn't have accepted the new one. And and I knew I had to, like, that was very, very traumatic for me, because that tooth I had been through a lot of trauma since I was a child, because when they put braces, they pushed it, like, very forcefully to the front, because that's one tooth that was growing in the wrong place. And it's so funny. Like, I just intuitively knew that I had to grieve it. I had to, like, let it go, be at peace with it, and be like, it's okay. You've done a great job. Now you can go, and I will have a new friend. And it's just like freaking weird. People are like, what is wrong with you? But I really felt that was the right thing to do. And our whole process was really seamless, wasn't it?
It was really, really amazing work with you.
Yeah, I was so happy.
The process, yeah, but it was beautiful, and everything in your tooth works so well, and it was a very difficult point. You have an infection, you had a big loss of bone, and a loss of gum, and now you have a new tooth, beautiful gum. It's really amazing, and it's very grateful for me seeing that, because it's your work in that moment too.
Yeah, I was definitely working with you, and I also took responsibility over the fact that I was coming through a lot of trauma, and one of the things, I got myself sick just like in the 2 years before that, and I was like, okay, I need to heal my body. And that was like a holistic approach. Like, type 2 diabetes had to go. I had to start eating in a way that I knew how to eat. I was eating before, looking after myself, like just regenerating the whole system. And it's amazing what it did. Like, I'm continuing to discover all these things and doing more like not protocols, but like, protocols within the guidelines. As in, I found something that works and I stick to it until I have to change it. But, I'm like, wow, it never ends. Like, your body's so dynamic. And if you don't understand the dynamic, you can get stuck. But if you actually understand how to work with different things, and this is why it's so important to actually have doctors like you, because I want to work with my doctor. I don't want my doctor to just work on me and I'm not participant in it,
I'm in holidays, and in these holidays, I'm reading this book. I don't know.
When the body says no.
Yeah, when our body says no. And this is amazing.
Exactly. I love that. Perfect point.
Yeah, oh my God. Is the point, isn't it?
Yeah.
And when we are learning and hearing from these doctors, these amazing doctors, we really appreciate the emotional and our psyche and our spiritual way of life is so important to take care of this for everything, even for the tooth.
Yes, absolutely.
That's why in the beginning I said that even the professional have to change the lifestyle, have to open his mind and his soul and treat himself to may treat the others.
Yeah.
I'm in process. I'm treating myself and discovering all my traumas, or some of them, because others I don't let me to see them. But it's a process. Yeah. And when we are growing up in our process, we become a healer naturally.
Yes.
Because we are healing ourselves, and our approach to others is the same. Yes. And they are saying, this is hurting me. Yeah, okay, what is more hurting you?
Yeah. Exactly. I love that. Thank you so much. This was so good and insightful, and I really I will put all your details. This is mostly for Portuguese, but I think even I know that you have a lot of foreign patients that come from abroad to see you in Porto. So I will put all your details in the show notes so that people can reach out to you and your team, and hopefully, hopefully life will really advance also in this in the space. And I know we didn't get to talk about the ins and outs of regulators, and I know they can make the work of holistic practitioners a little bit difficult. But I think that what you're doing is amazing work, and if you keep on navigating, the way that you're doing, I think you keep on helping people, and that's really what matters.
Thank you very much, Chantal. It's amazing be with you, and you inspire myself too. I'm looking to you, and your energy, your skin, your colors, all of you is an inspiration. I said to you in the first time I see you in my clinic, and I continue saying that you are really an inspiration, and thank you for this opportunity.
Thank you. Talk to you soon. Bye.
Bye.
Thank you, Anabela, for being on the show, and thanks everyone for staying on. I hope you enjoyed it, you learned a lot, and if you are in the process of discovering health from a different perspective, take into consideration your oral well-being as well. So I will leave all the details for Anabela's practice as well as more information about holistic dentistry below, so you can have a look and discover more, ask more questions to your current dentist if you need to, and just look for the best solution for you to really support your overall well-being. All right, I will see you next week, and as always, if you like this episode, please make sure you share it with your friends and help us grow. Bye.